Hi everyone, we're just going to wait a few minutes just to let people to join, but thanks for joining us for the talk this evening. Hi everyone, thanks for joining. We're just waiting a couple of minutes just to let people join the talk.
Okay, numbers have levelled out. Rhino, if you want to make a start.
Cool, so thanks everyone for joining us tonight, and thank you very much to Juliet who's kindly doing the talk for us. I'm sure some of you will remember her from our Cushing's talk last year. So this is our first talk for our respiratory health focus month. So throughout February, we're just going to be focusing on our horses' respiratory health. So look out on Facebook and Instagram for our posts that we're going to be posting. And this talk is on managing equine respiratory health, particularly in the winter. So we'll be talking about coughing and asthma, that kind of thing. So I'll let Juliet take it from here.
Thank you, Hannah, and thank you to GVG Brooks for having me along again this evening. So as Hannah said, my name's Juliet Abbott, so I'm really pleased to be able to join you this evening. I hope this talk's going to be interesting and provide you with all the necessary information to really help you optimise your horse's respiratory health as we are in those winter months. So the presentation will last about 45 minutes and it's split into a talk and also some video content for the more practical aspects. So there'll be lots of opportunity at the end to ask questions. So if you can use the Q&A function on your screen rather than the chat box, it's just easier to manage the questions if they're in the Q&A function. So feel free, as and when you think of them, as the talk goes through, do just type them in and then we'll come to those at the end. So let's get started by looking at what we're going to cover this evening. So it's vital that a horse's respiratory tract is as healthy as possible so that they can lead a normal life. But first we need to actually look at what the equine respiratory tract is. And then we'll move on to how you can identify signs of respiratory disease, including those that are quite subtle and might not be so easy to recognise. We're then going to focus specifically on equine asthma, because this is a very common cause of respiratory disease in horses. And then finally, we'll equip you with all the necessary information to really optimise your own horse's respiratory health this winter. So first of all, what actually is the equine respiratory tract? Well, it's a really vast, highly specialised system of passageways that extend all the way from the nostrils right to the lungs, and it makes sure that the horse's body receives enough oxygen with each breath. So the lungs are the most important part of the respiratory tract as they contain a really large network of small airways to increase the amount of air that's breathed in. They're also responsible for ensuring that the oxygen that is breathed in actually reaches the bloodstream so that it can be delivered to the areas of the body that need it. So just to give you an idea of the extent of these small airways, if they were to be laid out flat, then they would occupy the equivalent of 10 tennis courts. So a horse's lungs are very large. The oxygen that the lungs deliver to the body is key for both athletic function and also performance. And it's because of this that horses have adapted so that they can use up to 40 times more oxygen during peak exercise than at rest. And in addition to this, horses have evolved so that at a gallop, they can breathe up to 2,000 litres of air per minute, which is about 27 times more than at rest. So it might seem really obvious that breathing is important, but effective breathing is what's ensuring that your horse is provided with the oxygen that their muscles need, and also why it's crucial that your horse's respiratory system is as healthy as possible. But what happens when it isn't functioning correctly, and how can you identify when something is wrong? So there can be a really wide array of signs that you might observe, ranging from those that are quite subtle and less obvious to those signs that are much more severe and more easily noticed. So because the equine respiratory system has adapted for exercise, a very small abnormality can actually lead to quite a large decrease in performance. And this might be recognised as an athletic horse not finishing a race or having a slower time during the cross-country phase at an event. But it might also be noticed as a horse just not being as willing to trot or canter on a hack as usual. And if the airways aren't functioning normally, then the recovery time after exercise might also be prolonged as it takes them longer to get their breath back. And in addition, an occasional cough might also be observed. And often this might only be heard at the beginning of exercise, but it does often get dismissed as being normal or a horse just clearing their throat. So when a horse is more severely affected by respiratory disease, then as a result, the signs tend to be more obvious. And these signs might differ depending on the cause, but can include things like nasal discharge, which can range from quite white and watery to thick and green. They could have a fever, so where their temperature is greater than 38.5 degrees C, and your horse being generally quieter, lethargic, and not as willing to eat their feed. So a horse's normal breathing rate is about 8 to 12 breaths per minute. However, this is frequently increased when respiratory disease is present. So in addition to this, in very severe circumstances, a horse might struggle to breathe, may be heard wheezing, and might also have flared nostrils, as you can see in the image on the right. And that's in an attempt to increase the amount of air that they breathe in. And then finally, a more persistent and frequent cough is also commonly seen at rest in most severe cases. So it's really important to emphasize that if you notice any of these signs in your own horse, then you should always contact your vet for further advice. And your vet will examine your horse and can advise on the most appropriate course of action going forward. So let's see how you approach the respiratory system with a quick quiz. So I'm just going to launch my poll. So you can see the 3 questions there. So would you be concerned if your horse coughed at the beginning of exercise, also sometimes referred to as clearing the throat? Would you be concerned if your horse coughed occasionally during exercise? And would you be concerned if your horse was frequently coughing at rest, either on the yard or in the stable? So do please go ahead and just answer those questions for us. It's all anonymous. Give you a few more seconds to do that. Brilliant. So I'm just going to end that poll and share the results with you. Okay. So a bit of a mixture. So would you be concerned if your horse coughed at the beginning of exercise? 42% of you said yes, 58% of you said no. Would you be concerned if your horse coughed occasionally during exercise? Most of you said yes to that one. And would you be concerned if your horse was frequently coughing at rest, either on the yard or in the stable? And everybody said yes to that one. So thank you for taking part in that. So we've really sort of seen some interesting results there, and hopefully the information that we're going to go through now will really help to sort of clarify where we sit with these. So quite commonly, it is thought that an occasional cough at exercise is normal. However, interestingly, unlike humans, horses actually lack the ability to voluntarily cough. So horses with healthy airways don't cough, which means that in the majority of cases, a cough means that there is either a disease or a disorder of the respiratory tract. So for this reason, if you do hear your horse cough, even if it's only intermittently during exercise, then this should be investigated further. So there's a number of different causes of these symptoms. But as we're now in the winter, although today felt like a lovely spring day, there is often a noticeable increase in the number of affected horses. So similar to humans, horses can also be affected by respiratory infections. The most common are equine influenza virus, otherwise known as flu, equine herpes virus, and strangles, which is caused by the bacteria Streptococcus equi. These can be quite easily spread from horse to horse, especially during those cooler winter months when horses are stabled more frequently in close contact. And there'll be further details actually on these respiratory diseases at the next talk that GVG Brooks are doing on the 15th of February. So do watch out for more details of that on Facebook. So sinusitis is a condition that causes the sinuses in the head to become quite swollen and painful, and often with infection secondary to dental disease. So although this condition isn't necessarily specific to the winter, affected horses tend to develop a real thick, discoloured nasal discharge, which can look similar in appearance to other respiratory conditions. So other conditions that can occur are pneumonia, heart disease, and tumours of the lungs. Fortunately, these are quite rare in horses. However, when they do occur, they can cause a horse to become very sick with more obvious signs. And finally, the most common respiratory condition that affects horses, especially during the winter months, is equine asthma. And studies suggest that it actually affects up to 80% of horses. And because it's so common, and because we know that the significance of milder symptoms of asthma aren't always recognised, we're now going to really focus on asthma and how to improve air hygiene and to reduce airway inflammation in all horses to prevent it becoming an issue. So equine asthma is a relatively new term that includes all horses diagnosed with non-infectious inflammation of the lower airways. But you might previously have heard it as referred to as RAO or HEAVES or COPD or inflammatory airway disease. So this new term, equine asthma, was adopted as it was found that there's actually a lot of similarities between equine inflammatory airway disease and human asthma, and it makes communication about the disease much easier for everyone. So equine asthma is predominantly caused by exposure to high concentration of airborne particles or allergens in the horse's environment, such as those commonly found in hay and bedding. And once these dust particles are breathed in, then an inflammatory reaction develops in the lungs and the small airways become inflamed and narrowed, as you can see in this diagram, which is comparing a normal airway on the left with an asthmatic airway on the right. And once this occurs, it becomes much more difficult for the horse to breathe air in and out, and as a result, they develop associated signs. So although the stable environment is the most common cause, a smaller number of horses are more affected in the summer months when they're turned out to pasture and when the weather is warmer and more humid. So although equine asthma is an umbrella term, there are different forms of the disease which are classified depending on the severity. And these are referred to as severe equine asthma and mild to moderate equine asthma. So if we first focus on severe equine asthma, this used to be known as heaves, RAO, broken wind, and COPD. And horses that are affected by this form of the disease are generally predisposed to asthma. So similar to human asthmatics, and as a result, they can develop quite severe signs of airway disease when they breathe in either dust from the environment or they're turned out on pasture in the summer. It's believed to be relatively common, with estimates suggesting that up to 14% of horses in the UK are affected. However, unfortunately, there is no cure. And as such, these affected horses need to be appropriately treated and managed for the remainder of their lives. And we'll talk about this in more detail a bit later on. In contrast, any horse can develop mild to moderate equine asthma if they're managed in an environment which contains high levels of dust particles which cause the inflammation. So you're more likely to have previously heard this form of the disease referred to as inflammatory airway disease, or IAD. And mild to moderate equine asthma is much more common, especially in young athletic horses, with up to 80% of race horses being affected. So fortunately, because this is caused by poor air hygiene in the majority of cases, it means that these horses don't have this condition for life. So once appropriate treatment is given and the environment is improved, then these horses are much less likely to show signs again. So we know equine asthma is common, but the important question to ask is why? So to answer this, we must first consider how horses would naturally live in the wild. So if we look at this image on the left, we can see that these horses are outdoors. They've got a constant flow of fresh air, and with the majority of time spent with their heads lowered eating grass from the ground. So if we compare this to the image on the right, which is representing how our horses and ponies are commonly managed today, especially during the winter months. So in order to keep horses clean and warm, we bring them into stables where they don't benefit from fresh airflow. To keep them comfortable, we add bedding and feed them on dried forage rather than grass, which all contain dust and other irritants. They can't move around as much, and they're often fed from a height, which means that their respiratory tract cannot drain as nature intended. So it's no wonder really that airways can become irritated and inflamed. So that's why such a large proportion of horses can have lower airway inflammation, even if we don't always recognise the symptoms. So for horses with severe equine asthma though, exposure to mould spores and bacterial toxins found in the stable dust can set off an exacerbated reaction. So this is why in a barn of several horses kept in the same environment, only certain individuals will appear to be suffering. So as we can all identify with, especially if any of you have had asthma yourselves, anything that impacts on breathing is quite unpleasant and distressing. So we all need to be more aware of equine asthma so that we can address it and reduce the impact on our horses and ponies. So whether that's impacting performance or causing real suffering. And the longer that asthma is left untreated, the more long-term damage can be done to the lungs. So for some horses, asthma might simply mean that they're unable to achieve optimum performance. But for others with more severe signs, equine asthma can be a real welfare issue if it's left untreated. So the earlier that signs are detected, the sooner that horse can be appropriately treated and managed. And this can prevent long-lasting changes to the lung, which has the potential to impact them in the future and make the condition more difficult to control. So if we know that it's important to recognise and treat asthma, what should we look out for? So have a look at this list of symptoms on the right. So if your horse or pony has exhibited any of these symptoms, it might be worth just talking to your vet and asking them to investigate. And it's important to mention that horses with asthma don't have a temperature and go off their food as they might with a respiratory infection, for example, unless they're having a really severe episode of respiratory distress. However, we do often assume that a horse with a thick nasal discharge has an infection, when, unlike in people, a lot of horses with severe equine asthma can have quite a custody-looking discharge. And it's often seen in lumps around the stable, on the walls, or in buckets, rather than just coming out of the nose. But whatever the cause of the signs, your vet should be consulted. So to demonstrate some of these signs, I'm just going to play this short clip of a pony with an acute episode. So, oh, sorry. Sorry, it's just playing on my other screen. Bear with me. Start that again. So with this video, you can see, start from the beginning again so we can see the horse's nostrils. So yeah, so you can see that the horse's nostrils are flared and that their breathing rate is increased. And when we then focus onto the chest and the abdomen, you can see the amount of effort that is required with each breath much more clearly. So look clearly at that heave line. Play that again. It's quite a short clip. So across the abdomen, you've got this heave line, which is present, which if it's present, it can be quite a classic sign of severe asthma. And it's present when that intense effort to breathe out requires involvement from the abdominal muscles. And it's quite a distressing situation for any animal. So again, if you do notice any of these signs in your own horse, then it is really important that you contact your vet. So in certain circumstances, the diagnosis of equine asthma can be made by a vet purely based on the information that you provide and the clinical examination, including listening to your horse's lungs. However, unfortunately, the diagnosis isn't always straightforward, and where those signs are less obvious or where other possible causes need to be ruled out, then additional tests might need to be performed. One such test is airway endoscopy, which is shown in this smaller image on the right there. And sorry, yeah, so that image is airway endoscopy. So for this, they actually put a camera or a special tube is passed down your horse's windpipe, and they take samples of fluid from the airways, and then these samples can provide really vital information and can help to confirm the diagnosis. So once this diagnosis of equine asthma has been made, then your horse can receive the appropriate treatment and management. So a horse or pony with severe equine asthma has the condition for life, but with careful treatment and management, they can enjoy a relatively normal life. So human asthma patients, they often require lifelong daily treatment to keep their symptoms under control. However, this is not the intention when we're treating an asthmatic horse. So the main aim is to get the flare-ups under control with medication, as and when they occur, but then to manage that horse longer term by improving the environment and air hygiene. And as we said earlier, when an asthmatic horse inhales allergens in their environment, then an inflammatory reaction develops in the lungs. And this subsequently causes the airways to become quite narrowed and results in the clinical signs that we see. So therefore, different types of veterinary treatments are often prescribed to treat the condition. So firstly, corticosteroids are required to treat the airway inflammation, and these can be administered either by injection, orally, in feed, or via inhalation using an inhaler. And sometimes we do have concerns about using steroids in certain horses, particularly if they've previously had laminitis or they're overweight. So therefore, in these cases, a vet might decide to prescribe a more targeted steroid, which reduces the risk for these horses. So once that root cause of all the signs that we see, the inflammation, is successfully treated, then the airways will open up and cough and discharge, and respiratory effort should resolve. However, this can take several days to take effect. So if a horse is having an acute attack, which requires rapid treatment to really allow the oxygen to reach the lungs, then your vet might prescribe an additional medication known as a bronchodilator, which gives a really fast relief whilst those steroids are getting to work. And then finally, environmental management changes are crucial in every case, whatever the severity of the disease. So by making changes to the environment, we're aiming to reduce the amount of allergens and irritants that the horse is exposed to, so that the risk of developing airway inflammation is reduced. So the ultimate ambition is to ensure that an asthmatic horse remains healthy once that initial treatment course has been completed, so that they can remain in remission and we can reduce the amount of medication that is required going forward. So not only is it better for your horse, but it's obviously more cost effective for you as an owner as well. So fundamentally, all horses will benefit from a cleaner airspace, but for asthmatic horses, it's really crucial to prevent distressing long-term symptoms and to ensure that they live an enjoyable life. So even if you don't think your horse is currently suffering with any of the symptoms that we've discussed this evening, I would really urge you to try and follow the guidance to improve air hygiene and to invest in your horse's respiratory health. So I want to share with you a really practical guide to assessing your horse's environment and how to improve it. So we know from experience and also published studies that it can be quite challenging to implement these types of recommendation for a variety of reasons. And so as this is a really practical thing to describe in a talk, I've got a video to show you, which features Dr. Kate Allen. So she is a sports horse medicine specialist at Bristol Vet School, and it's going to give us a really detailed walkthrough of the process from her yard at the vet school. So I'm going to turn my camera off just whilst the video is playing, because it can be a bit of a distraction. We are still here though, and when the video finishes, we'll turn our cameras back on, and so will Ryan and Hannah, so that I can then do a summary and then we can come on to the Q&A section. As I said at the beginning, please do continue to put your questions into the Q&A box that you'll see on the screen, and then we can answer those at the end.
So Kate, you've brought me outside into a paddock. Why is that?
Because being turned out at pasture 24/7 is the best environment that we could keep a horse with severe asthma in.
And when we're thinking about that, why is it so important? Why is it so good?
Yeah. So if you remember when we were talking about earlier, we were talking about those inhaled particles being the primary problem. When we're out at pasture, the levels of inhaled particles are really low. So that's why it's the ideal environment. Also on a day like today, it's really windy, and so we've got great ventilation when we're out, and that keeps a flow of fresh air. And then the third thing is when the horse is out, he's grazing from the ground, and so his head and neck are low, and that really improves the drainage of particles and respiratory secretions from the respiratory tract. So it's another beneficial effect of being outside.
So it's really important to get them outside. as you just said, but actually thinking about horse owners day to day, it's getting harder and harder to get good pasture, good turnout. Would you say it's better to get them out even for a short while if you can't get them out all the time?
Yeah, absolutely. So the more turnout that you can arrange, the better it's going to be. And you know, we do understand that particularly over winter, and if you've got restricted grazing and this winter's been really wet, that it might be difficult for horses to be out 24/7, and in those circumstances maybe they can only be outside part of the day and they have to be stabled the other part of the day.
When we're also talking about outside and being in the paddock, are there any other things that horse owners need to consider?
Yeah, I think if I think of the cases where owners have turned horses out 24/7 but still haven't had that complete clinical resolution, the two main issues tend to have been having straw bedding within a field shelter or feeding dry hay within the paddock.
And are there other horses that might be affected more in the summer compared to those in the winter?
Yeah, those horses we term summer pasture associated obstructive pulmonary disease, and so that means the trigger, the allergen trigger, is something to do with the pasture, and that might be pollens or grasses or trees or microorganisms. And so those horses are more at risk in the summer periods when they're outside, and so we have to stable them during those periods. But because they've got very hypersensitive airways, when we stable them, we must make the indoor environment as clean and as dust-free as possible.
I think it's quite windy out here. It'd probably be a good opportunity to go and look at some stables and show us how to assess them.
Yeah, let's go.
Brilliant. Kate, this is a lovely yard.
Thank you, Emma. Because it's an equine hospital, the stables were designed for biosecurity as well as for good airway hygiene. So not everyone at home might have the features that we're going to demonstrate here, but what we're going to show is how you can introduce some of those measures quite simply at home. I'd really like to start by talking about stable ventilation, because it's an area that's very important and often owners and vets are unfamiliar with. I think we can say that there's many stables where we would consider the ventilation to be poor, and the only area for inflow and outflow is this area above the stable door.
So if I look at this stable door, actually to me that looks like quite a large area. So why are you saying that's not enough? Why do we need to do more? Okay,
so to have proper ventilation, we need both an inflow and an outflow as well. So if we take a look around here, we've got inlets both above the stable door, and we've got these windows here that are open. And at the back stable wall here, we've got another vent which is allowing outflow. And if we look up to the roof, the main ridge line is vented here, so we've got another outflow of air. So if we think about our main goal being to reduce the amount of inhaled particles in the stable, what good ventilation is going to do is move the air in and then out and take those particles with them. And so if we have poor ventilation, what happens is those particles are just going to hang around and an increased amount is going to be breathed in by the horse.
That makes complete sense. So Kate, practically, how can horse owners actually assess whether they've got adequate ventilation and their horse is stabled?
Yeah, so there are devices or pieces of equipment that you can use to assess ventilation, but easy practical clues are looking for cobwebs, if you have condensation dripping from your roof, if a bird has decided to nest in the stable, or if you've got a layer of dust on surfaces or even on the horse's rug, those are all indications that the ventilation's not strong enough to keep a good airflow.
So if an owner said, look, I think my ventilation's really poor, practically what can they do to actually improve it in their own stable?
Okay, so there's a few things, and it's really a little bit dependent on how much DIY owners are prepared to do. One of the best things, as we talked about earlier, is having a roof vent to allow outflow. So that will involve removing the roof ridge and raising that up. But other more easy things to do are looking at the back wall and maybe knocking out breeze blocks or knocking out a larger hole, or even getting drill bits and punching out a series of circular holes along the sort of upper level of the back wall.
So actually things that can be done in most stables, whether they're a breeze block, brick built, or actually a wooden stable, which would
they'll all be really beneficial at just creating that airflow.
I suppose here we're in a stable. We
Yeah.
also need to consider, what would you say about a barn situation?
Yeah, so barns are a little bit different because the horses are in a shared airspace. So again, we really need to focus on there being good ventilation, particularly for biosecurity reasons as well as for dust reasons as well. We know from different studies that simply closing barn doors increases the inhaled particles by about 25–30%. So
That's
it's
quite a lot.
Yeah, it makes a significant difference if you go around and have all the windows and doors shut. So again, it's trying to keep the windows and the doors open as much as possible to create that airflow.
So Kate, while we're in the stable, it'd be a really good opportunity to actually talk about bedding. And I can see in this particular stable, you've got wood shavings with rubber matting. Can you just talk about the principles behind that?
Okay, so for a horse with severe asthma, what we need to reduce is the inhaled particles and the moulds and the fungal spores that are inhaled deep down into the lungs. So we know from a lot of different studies now that traditional long stem straw is a really poor bedding choice for horses with severe asthma. So we need to make a change to more of a dust-free bedding.
So if we're avoiding straw, would you say shavings are best then?
So if we look at the literature, the main thing that we know that's evidence-based is that dust-extracted wood shavings are better than straw for the asthmatic. So we know we should make that sort of change. But if we look at what's commercially available nowadays, not only is there wood shavings, but there's wood pellets, paper, cardboard, chopped hemp, chopped miscanthus, chopped oilseed rape straw. There's a huge number of other products that are available. Lots of those have been through a dust extraction process. And some of them have even been through a sterilisation process to even further reduce the moulds and the fungal spores. And so some of those products may well be suitable, but we don't have scientific evidence from independent studies comparing all of those. So I think it's a case of going to your local stockist, seeing what you're able to get hold of, and really looking for products that are dust extracted. That's one of the best things that we can do.
So Kate, I can see here in this stable you've got rubber matting. Would you say that's something that's quite useful?
Yeah, I think it's ideal because the benefit of rubber matting is that we can reduce the amount of bedding that we use. And by reducing the amount of bedding, we're reducing the inhaled particles. So it is very beneficial on horses, in horses with asthma. So this rubber matting that we've got here is sealed, and that's probably the ideal choice. What we can see with a lot of owners is they buy individual mats and sort of jigsaw it together in the stable. And the problem with that is that urine can seep between the gaps. And sometimes that you find after a couple of years, the corners of the mats turn up and then you've got a bigger gap for urine to sort of seep underneath. And if you lift up those and have a look underneath, they can be really disgusting. And you've got a lot of old urine and dust and bits of bedding. And that's a real breeding ground for bacteria and molds and funguses and things like that. And that's only going to exacerbate the respiratory symptoms. If it's disgusting underneath, you need to lift them all up, hose it, disinfect it, let it dry, and then put it back down again.
Kate, something else that I've heard horse owners doing, just to try and minimise their horse's dust exposure, is actually using deep litter bedding methods. I can see from the look on your face, you're not
a fan
with that.
No. So what deep littering does is you're obviously leaving the urine in place and you get a build-up of urine, and with a build-up of urine you get a build-up of ammonia, and again that's a breeding ground for bacteria and moulds. I think when you're mucking out, if you can smell ammonia, that's already way too high a level.
Okay.
And so our advice is to take out the wet every single day.
So Kate, I know there was something else you wanted to show us and talk about, and that was mucking out.
Yeah, so we're going to go through a few points, and actually I'm going to put you to work, Emma. So if you start doing a little bit of mucking out, we already know that we're going to take the wet bedding out every day, but the other thing that's really important to do is to turn the banks every day, and that's right, and make sure you get into the corners, because a lot of that bedding gets left behind and becomes quite mouldy. And as we can see in a minute, if you just stop, we can see the amount of dust and inhaled particles that's been created just by you moving this little bit of bedding around. And actually, from a scientific point of view, we know that the inhaled particles increase by about 19 times when we're mucking out compared to when we're not mucking out. So our advice for horses with severe asthma is actually they shouldn't be in the stable when mucking out's being done.
And how long would you recommend, so you've taken them out, but how long would you recommend before you actually bring a horse back in?
Probably about 30 minutes for the dust levels to settle back down again. So yeah, being outside of the stable for that length of time.
And would that be the same if your horse was in their stable and next door's being mucked out, for instance?
Yeah, so again, it's a consideration of whether you've got a shared airspace. So if you're in like an American barn type system, if you're mucking out this stable, you're creating probably a 9-fold increase in inhaled particles for the horse next door. So it's important to think about not only when you muck out this stable, but also when the neighbouring horses are being mucked out as well.
Okay, what about sweeping? Is that something else we need to consider?
Yeah, so the best option is again that the horse is not in the stable or the barn when aisleways or outside the stable doors are being swept. If that's not feasible, then damping down the aisleway with some water prior to sweeping will reduce the amount of inhaled particles. Again, I would also avoid using leaf blowers in enclosed spaces because they create quite a big cloud of dust right in front of where the horses are breathing.
Okay, we've already talked about quite a few things today, but the one really big important topic that we haven't focused on yet is what to actually feed horses with equine asthma. So I suppose a good starting place would probably be to talk about the forage.
Yeah.
Can you just explain a little bit more?
Yeah, absolutely. So one thing that I wanted to sort of explain to you, Emma, is something that we call the breathing zone. So that's the area immediately around the horse's nostrils.
Okay.
And so although we've talked about management of the stable and the stable environment and the bedding and that sort of thing, it's really critical that we focus on reducing the inhaled particles in this immediate area around the horse's nostril. And in that regard, feeding dry hay is not a good enough option.
So Kate, you're just saying that actually we shouldn't be feeding dry hay to horses with asthma. What would you suggest they feed instead?
So we've got 3 main options for forage, and that's haylage, steamed hay and soaked hay. So this is an example of haylage, and haylage is commercially available both in small bales and large bales. And it's really important to think about how many horses are being fed that. So for most horses with asthma in a sort of a private yard, you're probably going to need to use small bales because we need to be able to use those bales up in a day or 2. Okay. You don't really want to be buying those large bales that are then going to sit around for a week before they're fully used. So haylage is a great option. It's very low in, if it's well made, it's very low in inhalable particles and dusts and moulds and that sort of thing.
The only thing that I suppose some horse owners may be thinking is actually haylage isn't suitable for their horse. Would you say that's correct?
Yeah, so traditionally we think when we think about haylage, it's a ryegrass that it's been made from. But actually nowadays there's lots of different alternative haylage options. So they can be made from a timothy grass, native grasses. This is an example of a timothy and a ryegrass mixture. So there's much more haylage options now which are suitable for a wider variety of horses. So if you had a native horse or a good doer, and you needed a lower sugar haylage, there are options available.
Okay, so actually haylage could be a potential option. If we weren't doing that, you suggested steamed hay and soaked hay.
Yep.
Can we just talk through those as well?
Yeah, so both of them is to taking traditional hay. So we have seen in the past people try to make their own steamers, you know, a bit of a homemade kind of variety. And we do know that actually that can cause more harm than good in that the bacteria can actually, if it's not steamed properly, you can actually get increased bacterial growth. So we would really advise using a commercial steamer. And there's different sizes available. So you can buy larger ones if you've got lots of horses, all the way down to smaller steamers that are suitable for 1 or 2 horses. And then for soaking, what we would advise is making sure that the hay is quite loose, so rather than soaking an entire bale, or if you're just doing it for a single horse, shake up the hay, put it in a hay net so you know you've got the right amount, and then we need to fully immerse it for at least 20 to 30 minutes. And then the important thing with soaked hay is that it should be fed while it's still wet. We shouldn't really allow it to dry out.
If, say, it was a bigger yard and they're having to soak a larger volume of hay, I suppose soaking multiple hay nets isn't going to be appropriate. Can they, in any circumstance, soak a whole bale?
Yeah, so this sort of container we can fit a whole bale in. The minimum you should do is at least cut the strings and separate the sections. If you've got room, then shake up the hay so it's much looser would be better.
So it's got to penetrate all of that hay.
The water's got to be able to penetrate all of the hay, yeah.
And if we're talking about these commercial steamers as well, sometimes I've seen they can get a bit of sludge at the bottom or potentially like old remnants. Would you recommend cleaning those out fairly frequently?
Yeah, so I think whether we're talking about soaking hay or steaming hay, just basic hygiene is really important. So whichever your container is that you're soaking the hay in, that needs to be regularly scrubbed out. If we're talking about the steaming hay, the kettle part, the bit that's generating the steam, that should be descaled at least 4 times a year. And then the container bit that the hay goes in, again, that needs to be regularly washed out.
And you talked about that breathing zone earlier. So things that we're trying to minimise the inhaled particles is the soaking or the steaming or using haylage.
Yeah.
Is it a factor of to how we actually feed it to the horse? Does that have an effect?
Yeah, absolutely. So what we know is feeding from a hay net, the inhaled particles are about 6 times greater than if we fed from the floor.
Okay.
So actually feeding from the floor is very beneficial, A, in terms of reducing the inhaled particles, but B, we're putting the head low down in that natural position that we talked about when we were out in the field. So it really is beneficial for drainage of any respiratory secretions and things like that. So yeah, for a horse with severe asthma, our gold standard is to feed from the floor.
So Kate, we've just talked about different forage options for horses with equine asthma. Do we also need to consider the storage of these forages as well?
Yeah, that's really important, Emma. We know from a recent horse owner survey that about 25% of horses are stabled in the same airspace as the hay or straw is being stored. Yeah, it's quite a lot. And it just means that the horse can't avoid those inhaled particles. So ideally we separate the 2 air spaces. So your forage and your bedding is stored somewhere completely different. So from a forage point of view, yeah, it should be a separate airspace, it should be well ventilated, it should be not very damp. And what we really want to do is store the hay on pallets to keep them up off the ground and have some ventilation underneath them.
And do these areas, I presume they need to be easy to clean, particularly for something like hay, which is just quite
again,
damp or moist anyway?
Yeah, back to sort of general cleanliness, general hygiene. What we don't want to see is new bags of haylage being opened on old remnants of haylage and from the bags before and things like that. So just general cleanliness, yeah.
That's been absolutely brilliant. I suppose the next thing would be to actually look at feeding, so hard feed, concentrates, etc.
Yep. Well, we've got some examples here that I just wanted to show you. We know that there's some dust in concentrate feed as well. It tends to be greater in what we call straight, so like a bag of oats, than it is in these sort of compound feeds here. So however we feed concentrate feed, ideally we've dampened it down. So again, that reduces the inhaled particles. But in terms of storage, what we quite often see is owners empty the bags of feed into one of these big feed bins.
They can be quite deep,
can't they? Deep feed bins. And they're tricky to clean out. So I think for most sort of small, medium type yards, you'd be better feeding straight from the bag, because what happens in those big feed bins is people use up sort of 3/4 of the feed and then start filling it up again and use another 3/4. And that bit at the bottom never really gets used, and that becomes quite mouldy. So if you're pouring your feed into the feed bins like this, you really need to be using it within a week or two, and then you have to clean it out, wash it out, let it dry before you refill it again.
Okay.
So if you're not going through the feed that quickly, or you haven't, it's not a bin that you can clean out in an easy fashion, it's much better just to feed direct from the bag.
And that is a lot easier, isn't it? You just literally
Easier.
open the bag,
Yeah.
pop it in the bin, and we're done.
We're done.
Kate, do you think owners should be talking to their vets when they're considering making a change such as forage in their regime?
So we've talked a little bit about the options of haylage and steamed hay and soaked hay, and I think if you're unsure in terms of the nutritional values, particularly if your horse had concurrent issues, whether that be obesity, laminitis, that sort of thing, then yeah, it would be really good to contact your vet and just talk through those options with them.
Kate, we've covered a lot of ground today and you've gone through loads of different things, but are there any other points you can think that owners need to consider?
Yeah, Emma, I think there's two things that we haven't touched upon. One is the muck heap and proximity to the muck heap. So whether the horse is in the stable or out in the field, he shouldn't be near the muck heap. The second thing is to think about when you're travelling the horse in a trailer or in a horse box, and the same rules apply as how they did in the stable. So we don't want there to be straw bedding and feed the same forage, whether that be haylage, steamed hay or soaked hay, that you were doing in the stable.
Okay, once an owner's implemented all of the changes that we've discussed today, what can they expect going forward?
So we'd expect the horse to be in a state of remission, really, once it's completed its medication and we've made the environmental changes. So it should be free from coughing and wheezing and able to exercise. And if we can maintain those environmental changes in the long term, the horse probably doesn't need long-term medication.
Okay. So Kate gave lots of really useful information in that video. So I really do hope that you now feel confident to make these changes on your own yards over the next few days, weeks and months. So I'm aware we've covered quite a lot of different aspects of equine respiratory health this evening. So I just want to finish by summarising those key points and those take-home messages. So firstly, every cough does mean something. Whether you notice that your horse is frequently coughing at rest or only occasionally during exercise, it should always warrant further investigation. And the earlier that these signs are detected, the sooner your horse can be appropriately treated and managed to prevent long-lasting changes to their lungs. It's also important to remember that managing the environment is really crucial for optimizing respiratory health for all horses, but it is absolutely essential for the welfare of asthmatic horses. Unfortunately, there is no cure for severe equine asthma, but with the correct management and treatment, then these horses can continue to live a normal life. So I'd really like to thank you all again for joining us this evening, and I hope that the talk has been thought-provoking and informative and given you all those essential bits of information to ensure that your horse's respiratory tract is as healthy as possible this winter. So as I said, we're going to come on to a Q&A session now. So if you have got questions, please do type them into the Q&A box. I'd like to say now as well that when the webinar ends, there will be a survey that will pop up. And myself and the guys at GVG Brooks would be really appreciative if you could just take a minute to answer those questions, because it will just help the practice to plan for future client evenings with what topics you would like, and just to get some feedback on this evening's talk. So Ryan and Hannah, if you want to pop on your cameras, thank you. So let's just stop sharing the screen. Okay, so let's have a look at the questions that we've got. So Susie has asked, I've been feeding my hay on the floor. Is this beneficial over feeding from a net?
Yeah, so I think this sort of was mentioned in the video, but yeah, feeding on the floor is good. It sort of reduces the dust particles, and also the horse has got their head down to help kind of get any secretions or anything like that out. So yeah, I think feeding from the floor is good.
Thank you, Hannah. Susie also asks, outside I started to feed the hay in a tub to stop it from blowing away. Would it be better if the hay is not in a tub?
I think with this one, if you're just taking the hay from where you keep it and putting it in the tub, that's okay. Probably we don't want to be leaving it in the tub for days and days and letting all the dust gather. But yeah, having it loose, maybe that's slightly better, just gets the air through it. But obviously you have got the problem that it may blow away. So I think a tub is fine if it's in there and it's kind of fresh and kept.
Thank you. Can a heart murmur impact on respiratory health?
Yeah, I think it's pretty unlikely, to be honest. It depends a little bit on exactly what's causing the heart murmur. So a heart murmur itself usually means that there is some sort of degree of problem or sort of insufficiency with a valve in the heart potentially, but actually horses also can have heart murmurs, and actually there's no kind of physical problem with the heart, and actually it's just that the blood's flowing in kind of the opposite direction because their hearts are so big. So I think it really depends on what is the cause of the murmur, but actually heart failure in horses is very, very rare. So although we think about kind of coughs and breathing issues in sort of people and dogs and cats associated with heart disease, actually in horses it's pretty unlikely.
Thank you, Ryan. Susie's just said in regards to the tub that it's bottomless. And there we go. Okay. Georgia has asked, how would you identify between choking and coughing?
Yeah, so I think it depends probably what you mean by choking. Horses don't tend to sort of choke in the way that we do in terms of getting a kind of a sort of a physical obstruction in their windpipe, in their trachea. Choke we tend to talk about in horses is actually an obstruction in their esophagus, in their kind of the gullet, the food pipe that goes down into their stomach. So that tends to kind of present with quite different sort of symptoms. They'll often be kind of stretching their head out. They'll have lots of kind of frothy stuff coming out of their mouth or their nose, often with sort of food material packed in there. So yeah, I mean, a true sort of windpipe obstruction in a horse is really, really rare, and they tend to, rather than be coughing, you tend to sort of, again, they'll be breathing fast, kind of stretching their heads out. You'll often notice kind of nostril flaring, and you can normally hear noise. So because the airway's a little bit obstructed, the air's kind of passing it, and it's a narrower space to get through. You'll sometimes hear sort of whistling or sort of harsh sort of snoring sounds. But yeah, it's pretty rare to be seeing that sort of thing. So yeah, generally when we're talking about choke, it's not the airway that is obstructed. It's something stuck in the back of their throat, essentially.
Okay. Lisa has asked, would you recommend a FlexiNeb over a spacer for ponies prescribed inhalers?
Yeah, I think it's a little bit up to you, to be honest. There is some evidence that the FlexiNeb can help a little bit with distribution of kind of the drug into the lower airway. FlexiNebs, one of the main reasons we tend to use the spacers is that the FlexiNebs are pretty pricey, and the spacers are, they're kind of the pediatric spacers that go over one nostril are pretty cheap. And a lot of horses will accept them, but I mean the FlexiNebs are definitely more user friendly, and yeah, potentially they improve the kind of the ability for the drug to get right down into the lungs where it should do. But yeah, because they come at a considerable price tag, lots of people will manage well with spacers, and I see plenty of horses that manage well with inhaled medications used on a paediatric space there.
Georgia has asked, could a horse cough so much that they can't catch their breath?
Yeah, so sometimes when we see them coughing, it does seem like it's like us when we cough, you know, sometimes we have a bit of a coughing fit. It does take you a moment just to get over it so you can take your next breath, but that's the same thing in horses really. They will get their breath eventually.
Okay. And Lisa has asked, when my pony's asthma is bad, he can make a guttural noise. Is this common?
Yeah, so I think it's not uncommon, I suppose. If they're making sort of more of a noise, I'd wonder whether there is a degree of an upper airway issue as well. So certainly we do see horses with asthma. They can have issues around their larynx and pharynx at the back of their throat, and that can sort of cause a sort of a more noisy obstruction of their airway. Generally, we sort of have to diagnose that on endoscopy, but actually you often find that by getting the asthma under control, you improve that a lot. But yeah, so I'd say that's probably more likely an upper airway kind of sort of restriction rather than it being a lower airway thing in the lungs. But sometimes with sort of a real exertional wheeze, you sometimes hear some of those funny noises too. So yeah, it could be either.
Cool. Right, that's all the questions that have come in so far. If we just give it a minute to see if anyone's frantically typing away. Whilst we're waiting, Ryan and Hannah, were there any other comments that you wanted to add whilst we're on the topic of asthma, etc.?
Yeah, we were just saying actually that in the talk it mentioned about giving bronchodilators such as ventapulmin, which is something we do use quite a lot. But we just wanted to say that normally it's not something we recommend for a long period of time. We normally do a course of 5 days, as if you keep the horses on it for a long time, it basically reduces in how well it works. So yeah, we normally just do a short course and don't recommend use of it for a long period of time.
Yeah, absolutely. Thank you. Oh, question come in. Susie, my horse was diagnosed just over a week ago. Long term, might she be able to do faster work given appropriate treatment and management, e.g. hound exercise?
Yeah, I think it really depends on sort of how bad it is really. The vast majority of horses that we see with asthma, we will get the disease into remission where we sort of have their symptoms under total control. Some horses require ongoing medications to do that, but actually the vast majority of the kind of the mild moderate ones actually making all those sort of environmental changes that were mentioned in the talk can be enough. And then actually if you have flare-ups, then you can sort of use medication when required. But yeah, I mean, certainly if it's not a problem that's been going on for months and months, and hasn't been able to get it under control, I'd be pretty hopeful that actually the lungs have they have a pretty good reserve and a reasonably good healing capacity if it's been nipped in the bud early. So I wouldn't be worried that that the horse can't do its job.
Thank you. Would you say asthma is improved with general fitness levels, from Georgia?
I think the simple answer is yes, definitely. But it's important to bear in mind those environmental changes in terms of optimizing kind of the environment for the airway, whether it's dust or pollens or whatever may be that horse's problem. But yeah, fitness, absolutely. I think it's a no-brainer for me if it's achievable.
Yep. And then my horse lives out and has a large hay reel. Always this time of year, he does have a hay cough. Today I've taken him off the hay and started soaking the hay to give him a reprieve. Do you think this is a form of asthma that seems to be hay related?
Yeah, it sounds like that may well be the case. And I think it's a great idea to start soaking hay and see if you notice an improvement there. just to help reduce those dust particles. So yes, I guess the short answer is yes. But it sounds like you're doing the right things by starting to make changes to the environment and see if you notice a difference.
Okay. Right, there's no questions at the moment, so we'll just give it a, oh, there we go. Can we get access to this video shown during this presentation as a reminder to all the tips given? Yes, you can, absolutely. The video is on a website for the Equihaler. So if I give that link to Ryan and Hannah, then you can share that with Susie, is that okay? Otherwise, it is just equihaler.uk and just say that you're a horse owner and you'll be able to see that video on there. Okay. Right, I don't think there's any other questions. We'll just give it a couple of seconds. No, I think that's all the questions. So from my side, before I hand over to Ryan and Hannah to close the evening, I'd just like to thank you all very much for attending and hope that it was an interesting and informative evening. And as I said at the beginning, please do just take a second to answer the survey that will pop up when the webinar finishes. So thanks very much, and I'll hand back to Ryan and Hannah.
Perfect. Well, thank you so much, Juliet, for that talk. It was really interesting and had lots of good tips. So hopefully everyone else was able to take some good advice away from this evening. Our next talk will be on the 15th of February. So just a reminder to say look out for that, and there'll be an email coming out with the link. Otherwise, it's on our Facebook page, and we'll put it on the Instagram bio as well. So you guys can register for that if you're interested. It will be about infectious respiratory diseases, so we'll be looking a bit more into those. But yeah, thanks again, Juliet. It was a really good talk this evening.
You're welcome. Thank you. Brilliant. Thanks very much, everybody.
Great. Night.
Bye-bye.